Renee, do we have a guest on the episode this time?
We do. It looks like you've brought a friend of yours here today to chat with us all about mental health in the Midwest. Sounds like she's from your part of the world in the rural farming community and knows some families that are all about the farm. So I'm excited to hear this conversation. Wow, she's got a lot in her bio, but I'll let her introduce herself in just a minute. But before we dive into our guest today and talk all about Midwest mental health, Jason, what's going on the farm?
Well, so this is that time of the year where I sit around and fret about prices and the corn I still have left in my bin. And then, I flip onto the camera and like think, boy, maybe we should haul something, but prices are horrible. So this is just a good time to be at home. It's dark outside most of the time and just obsess about all of the things that farmers worry about. That's not a very uplifting intro.
That's why we call it the whiny farmer
I
intro,
know.
because that's
I
pretty
know.
whiny. That's pretty normal though. Tis January. It's kind of dark, kind of dreary out there. So tis the
Right.
season to be worried and fretting about prices.
Right. Right.
Well,
There I
luckily
am.
for me, that's not my reality. So I don't have to worry about the prices, everybody. But today we have a guest. And Jessica, I would like you just to tell everybody who you are. Tell us about you. How in the world do you know Jason to kick us off? And we'll go from there.
I don't know what she's going to say to that. So this will be
I know.
interesting. We're
That's
all going
why
to
I
learn
asked the
something.
question.
Yeah, well, thank you for having me. I'm super excited to be here today. As mentioned, my name is Jessica, and I actually live in rural Northeast Iowa, way up here on the Mississippi River. And I met Jason through Iowa Primary Care Association, actually. So their district leader for our district area introduced me to Jason and your team, and we had an amazing conversation back in October. And he's like, "Hey, why don't you come join me on my podcast and listen to me whine about farms a little bit?" So,
Sounds about right. Well, we're glad
yeah,
to. So, Jessica,
yeah.
what do you do all the way up there on that border? What's your role? What's your job?
Yeah, for sure. So I actually spent about 21 years working in healthcare in a variety of different areas, family practice, women's health, community education, philanthropy, did some leadership development, organizational development for critical access hospitals. At the time of COVID, I was working as a health coach in cardiac rehab and behavioral health department. My position was eliminated. It was a kind of a thank you for giving me permission to leave the healthcare field for a while. I was burnt out and ready to move on. So, at the same time, though, my son was experiencing some suicidal ideation, depression,
Mhm.
anxiety. And so, as I started to navigate the mental health care system with him, I saw what I saw for 21 years in healthcare. We do a really great job of telling people what they need to do to get better, but not giving them the support and resources beyond the clinical setting to make those changes.
Mhm.
And so beyond that too, just a lack of rural support or providers in our area. And so I decided to take everything I've ever known for 21 years, put it all together and start a nonprofit organization. So our organization is called SIVA Health, and we provide what is called brain health coaching.
Mhm.
Different than therapy in the sense that we don't diagnose or prescribe any mental health disorders or any mental health medication. We really work alongside individuals to help them figure out, how do I move forward? What's impacting me right now? And how do I build skills to kind of manage my stress or whatever it might be? So we serve individuals of all ages. I would say probably usually ages 5 to 60. And we also have a couple contracts through the state to support at-risk youth and justice involved youth.
Mm, awesome. Well, I've heard of your company name before, but I just guess I haven't put that together that that's you. So
Yeah.
nice to meet you.
Yes.
So, do you have contracts with PCA then for the behavioral health system, the mental health system up in your area? Is that how you're connected, or did you just come because they were talking about the district and the community and you wanted to know more?
Right. So we currently do not have a contract with Iowa PCA. I've had conversations with them in regards to just kind of watching the changes throughout the state behavioral health plan, right?
Mhm.
So I'm also a member of the Iowa Integrative Health and Planning Advisory Council. Sorry, we've changed our name a couple times. So
Mhm.
so I'm familiar with kind of how those state changes are happening, and that's how I got connected with PCA. But fun fact, our district leader is an old colleague of mine. So
Oh,
yeah, so when I saw that Ashley was kind of our district lead, I was like, "Hey, want to connect?" And then she's like, "Hey, want to meet Jason?"
nice.
Well, that's what it comes down to. I really think though it's about innovation, right? And when we think about the mental health shortage areas and the lack of providers in these rural areas, I'm really interested in the coaching. And so maybe Jessica, talk to us about what role coaching fills, because I don't think a lot of people in the behavioral health sector understand
Mm.
how supportive coaching can be and how coaching's different than some of the other terms that we use sometimes.
Yeah,
Can you walk us through that
definitely.
a little bit? I think that would help people understand it a little better.
Yeah, and I think it's such a great area, right? So I'm a national board certified health and wellness coach. And so a lot of our training is based on motivational interviewing, which is a really great practice to help people kind of behavior change, right? And so coaching can be supportive in so many ways. It can be supportive in developing coping skills for anxiety, stress management, depression. It can be really helpful in figuring out like, where am I at now and where do I want to be in the future? How do I move forward into that space, setting goals to be able to do that? We will talk about the past a little bit, but we don't dive into it and we don't really process through that. We leave that more to the therapist to do that pieces of it. However, we can help with kind of reframing some of those negative thought patterns, building resilience, developing those coping skills. We also work with youth who've been diagnosed with learning disabilities on executive function skills as well. So, emotional regulation, time management, organization. I think the big piece of what I love about coaching is that we kind of have this whole person approach, right? And so versus just really focusing on talk therapy, we're looking at everything. Like, do I need to send you to a provider to have labs done? Do we need to check to see if you have low thyroid levels, low vitamin D levels, iron levels? Are you a woman perimenopausal and now your hormones are giving you some anxiety, depression symptoms? And
Mhm.
we really need to address your hormones versus this. So looking at really that whole person, and also like nervous system dysregulation. I think that's another piece of it too, of let's incorporate some mind body activities and not just focus fully on that talk therapy. So, like I said, it's really broad range of the things that we can do. Coaching sessions are 100% driven by the individual and the client, right? Whereas more therapy is a little bit more of like the therapist might be providing some feedback, some thoughts on those things. Where in coaching, the client's the expert. We're just here to kind of help them navigate that journey.
Yeah, and I think that's what I really loved when you talk about this. You really connect the healthcare world to behavioral healthcare
Mhm.
in
Mhm.
a way that is really articulate and makes just a lot of sense of why aren't we doing more of this. I kind of left after we met with you, kind of questioning, well, why isn't there more of this connectivity? Because so oftentimes we hear, well, we made a referral to a therapist and it's going to be 6 to 12 weeks.
Yeah,
Well, that's not helpful because
Yeah.
there's a lot of other supportive things that could happen in between, and I've really liked thinking about the whole person, right? Because it's a
yeah.
lot more than just going and seeing a therapist. There could be some issues involved, with diets or food
Mhm.
intake, like other things
Yep.
that are happening that we need to take into account for.
Yeah.
And so I'm really intrigued.
Yeah. And I think I see that a lot too with youth, having conversations with them about their lifestyle. Like, are you drinking sugary caffeinated drinks all day long and not hydrating with water? I mean, that's going to give you some anxiety for sure. What's your diet look like? How much are you sleeping? How much screen time do you have? Are you exercising? Like, all of those, more of like that physiology approach versus that psychological approach to some of it as well. So, yeah.
Yeah, I was thinking about that with kids. When we were down in Louisiana, there was a group of folks at the Rural Health Conference there, and they had a grant on obesity in children. And it ties into your lack of exercise, the wrong foods, too much screen time, etc. But they had no concept that it touched connected to mental health, right? And so
Right.
my conversation with them was like, wow, what a great way to potentially bring mental health into a conversation when you're really focusing on these other issues. Because in many, many kids, not all, but many, because serious mental illness is a small percentage. Many
Right.
kids, if you get better at being more active and less screen time and better nutrition, more sunshine, they're not going to be qualified for a mental health diagnosis. And so,
Yeah.
but we skip all that part, especially in kids. And so
Yeah.
there you see all of the uptick in all of the diagnoses, but it's not about that. It's about like you just said, the energy levels that they have, and are they expending those correctly or amping up more on what they're eating, drinking, those kind of things. So it's a really important piece. So do you have some folks that come your way when they're talking about maybe their diet, whether they're diabetic and not, because those matter so greatly in the mental health world. A lot of folks have comorbidities with lots of physical issues too. So if they're not managing their diabetes well, they'll have all of these mental health symptoms. So I'm guessing those are some of the clients you see across that age band.
Yeah, 100%. And I think, gosh, you just hit the nail on the head, Renee. Like not everyone has clinical level symptoms. And I think
Mhm.
that that's where it's so important to realize that coaches can fill that gap in that lack of providers, right? Because not every child needs to see a therapist. They might just need somebody who can help them sort out their feelings and kind of set some goals to improve their quality of life. Coaches 100% can do that. And so, yeah, absolutely. When I work with an individual, I really like to focus on the whole person and looking at, do you have underlying conditions that are maybe contributing to how you're feeling and your mental health? And Jason and I touched on this a little bit. Like, if you have heart disease, you're probably going to have a cardiologist, you're probably going to have a care coordinator, a nurse, a primary care provider, cardiac rehab, a dietitian, maybe a therapist, all these people to support you with your heart, right? And so the brain is also an organ, but oftentimes we really only give people a therapist to support their brain when there's so many other things that you can do. So yeah, I mean, you're 100% correct in that.
Yeah, we see a lot of women. I do some counseling with our church, and there's a lot of women that hit that perimenopause, menopausal stage that'll all of a
Yeah.
sudden think that they're, losing their minds, either the brain fog or forgetting
Yeah.
things, or they're overly anxious, or they're doing that cortisol wake up at 2 a.m. and
Yeah.
think that that they're mentally just not there. And it's 100% their hormones, like you just said. And so,
Yeah.
just even having somebody that'll say, have you checked that
Right.
first before you decide now you've got this severe disorder, that sudden onset of something horrible? And most likely it could be because your body changes. And so the supplements that worked for you all those years may not anymore. And you may
Yeah.
need additional supports. And so you may be thinking, well, I'm doing all the same things, but now all of a sudden I've lost it. Well, your body may have shifted somehow and you
Yeah.
don't even think about it. So it's really an important conversation. So I'm grateful to
Yeah.
hear that. So where are you hoping to expand and grow? What other things do you hope to do? And I mean, how many people do you have that do this? And how many more people can you see working in that space?
Yeah, so currently, I'm the only full-time coach. We do have a part-time employee. She's actually a physical therapist, and she works for us going into the schools doing education with the
Oh, cool.
kiddos. She's actually doing a program, Neuroscience of Pain. So she's talking to middle school
Ooh,
kids about pain and how to manage sports injuries, other things,
ooh,
instead of
that's
going to
good.
the like opioid approach to that. And so she's also taking a course right now on some pain management stuff, and hopefully down the future to bring her in a little bit more to work with some of our clients
Yeah.
who are maybe experiencing like some nervous system dysregulation, things like that. I've recently have had some questions about peer support and how we can possibly bring that into our area. The closest peer support, peer respite place is Clinton, Iowa from
Yeah.
us.
Yeah.
Yeah, so ways.
Far.
I think Cedar Rapids might have a organization that way
Mhm.
too, but I mean 2 hours at
Yeah.
least away. So yeah, so starting to have those conversations with some stakeholders as well, what that might look like for us. So we have some ideas when it comes to 2026. For me, one of my biggest dreams is that the state of Iowa will eventually see the value in coaches and how we can bring them and pull them into the mental health space to fill those gaps. And so definitely I've got some ideas on how we potentially can do that. But
Well, and I think if we think about the data, 90% of counties in Iowa are designated a mental health professional shortage
yeah.
area. And it seems like this would be a natural fit. I love the idea of, how can peers be integrated into that? We think about community health workers, but we think about specifically how coaches connect that healthcare system with behavioral health and especially with kids that we know are really going underserved across the state today. It just makes a lot of sense. And so when we were out traveling, we were looking for innovation, right? And so this is a really great innovation that could be scaled to have a greater impact. And I
Mhm.
think I'm really excited for the work you've done. And you've shown people that this makes a lot of sense and it works. Unfortunately, that doesn't mean it always gets funded. And I think that's the
Right.
frustrating part as we
Mhm.
think about systems. And this is Renee and I love to talk about systems, right? Is how do we take an innovation that has a good track record that's showing that it works,
Yeah.
but then scale that and make it grow
Mhm.
and show some data that it can fill a gap in the current continuum of care. And so, that was
Yeah.
what I really was excited about when we met because
Mhm.
there's gaps. You found a unique and innovative way to fill gaps
Yeah.
and still create an impact.
Yeah.
Yeah, just because I'm a policy nerd and have written all these policies for the state of Iowa, I could tell you the direction not to go would be to try to make yourself a behavioral health specialist or a behavioral health provider in the code.
Mhm.
because the code is very specific on who qualifies in that space, and it's
Yeah.
very protected, and lots of people argue. There's lots of lobbyists involved. It's just not cool. But what you can do is 100% on the side of the primary care part, which is with where PCA is and what you were talking about, partnerships with them. There is no reason in the world why primary care is not focusing on health coaching, and that it
Yeah.
crosses across is beautiful, but you are doing the whole person. And so
Hmm.
you should be able to bill on the primary care side for your, all of your labs and all of your work and all of those different things, just like a nurse or a nurse practitioner. And so I think the medical side, there's probably a space that could work with coaching for people, and they could be able, because you wouldn't have to fight with that other side.
Right.
That's not fun. You just don't want
Yeah.
to do that.
Yeah.
Occupational therapists fight with them almost annually and lose on a regular basis. And it's like, you
Hmm.
guys are medical, stay in your lane, cross where you can, but don't
Yeah.
try to become something you're not, because it doesn't go both ways, right? So,
Yeah.
a behavioral health specialist not going to be able to just start doing occupational therapy or your job as coaching. And
Hmm.
so it's like, you want to, everybody has a lane and they're all really particular about all of it. But
Right.
primary care, I mean, you're right, that's the space. And peer recovery, what would be fantastic is if you could help people that they see the value themselves and then become a peer specialist
Yeah.
that represents what you're talking about, because
Hmm.
some of the peers that Jason and I work with on a regular basis could have used ongoing coaching to kind of help them through their journey. They did it
Right.
all the hard way and are now toward the end of recovery, but they have a lot of stories about just where the gaps were, and they fell in the ditch and had to start over, and they relapsed, and all these things where a coach would have been so helpful to them just to be
Right.
get further faster. And
Hmm.
rural communities especially, it's just how we
Yeah.
hear it all the time.
Yeah.
It's pretty exciting.
Hmm.
Jason, did you want to talk about any additional data?
I don't know, no, because my head's just spinning. I think it helps us, and what I love about this conversation is it helps us to think about the system and how we could have different levels of individuals with different backgrounds and expertise that
Hmm.
can really fill out the continuum of care.
Right.
We've limited ourselves so much, especially in the state of Iowa, by continuing to put physicians at the very top, and not thinking about all of the other parts and pieces it takes to support someone through their disease journey. That's why I love the heart disease example. Even the IT systems are connected on the medical side, and we're so fragmented when it comes to behavioral health
Right.
care and connection to healthcare. And so I'm excited to hear about, these types of initiatives and the work that Jessica's doing, because I think more people could learn from this,
Hmm.
and start to think about how can we make this more the norm as opposed to the exception where this is happening.
I agree. It'd be interesting to see. My brain now is thinking about all the funding ways to get you funding, because you're right. That, I mean, that's how my brain works. Apologize in advance. Jason
That's
knows I'm
okay.
always in the middle of the Medicaid budget. I'm always about the budget, because I'm like, that's where you know how things actually work. People can tell you this and this and this, but where the money goes is where it's actually going. And
Yeah.
so there really is an opportunity. And I know, I mean, now I realize how Jason met you, because when they were out on the road for PCA, their goal was to find the bright shining stars, the new innovations, the new programs that were out there, to try to tell PCA, hey, you should do this across the state. So just know
Yeah.
you're already in that conversation without me even having to read the report. I already know that, because that's where
Yeah.
Jason's brain goes. And so, that's exciting, because it is something that I don't think we've really thought about wellness coaches and health and wellness as a way to expand in that gap. And we've
Right.
talked peers before, but I don't think we've talked coaching. And so that's a really brilliant idea. Not what I thought we were going to be talking about today at all. So I'm very excited about that. Jason, did you have anything else you wanted to chat about this project and things you were
I
excited
did,
about?
Jessica. What are other things you want us to know about you, or what do you want to talk about? Because this has been, I think, really enlightening,
Yeah,
and I
there's a
think
lot to
more
think about.
people need to. It helps people to get thinking about this in a different way, and that's what I'm so excited about. I think about all the places we travel, Renee. We don't talk about wellness coaching at
Mm-mm,
all in
Mhm.
a lot of
mm-mm.
the places that we travel to. There's been a big push toward public health and community health workers, which kinda, but it's not really the same thing. And so
Even
that's the
that
other part.
obesity program I told you about was still
Yeah,
community partners, and it was like
right.
public health. It still wasn't from a coaching perspective.
So there's a lot of
This is unique. It's very interesting, very
So we do a
intriguing.
lot of education to teach people about all the nuances, and how all of these things can fit into a system. And then we need to start structuring our system differently because we know more now than we did when this system was structured,
Mhm.
and those specific codes that are in Medicaid today, started, in the 70s or whatever. It's been a long time ago, and things have changed, and our knowledge of things of what works have changed, and our workforce has changed. So maybe we need to change. I don't know.
Yeah, I mean, I definitely think that, I've hit resistance in some sense when I meet with therapists or people in the behavioral health world. I've had a few people who I've met resistance with, but for the most part, people have been like, "Whoa, there's a service here. Well, okay, we need to send people to you because we don't have the capacity anymore, right?" And so we've built some really great relationships with some therapists, and also I think for them just to see too, like, what else can we bring to the table? I just recently went to a court case with a juvenile who's truant and trying to get her back into school. And the judge asked me, "Well, what's your opinion or what do you think?" And, everyone wants to send her for a behavioral health evaluation, this and that, and everything, which those things are great. I don't disagree with that. However, she's telling me she struggles academically. She needs to have an evaluation for an academic IEP. And so, they were like, "Whoa, we didn't think about that." So just like we have a lot to bring to the table. Do we know everything? Absolutely not. And do we need the other people in those spaces? 100%, right? So it has to be a collaboration. But like you said, Jason, we've got to start being innovative and looking outside the box and welcoming in some of those other providers. I think that health and wellness coach is so new. People don't understand exactly what it is and what it means. There's also not any regulations as far as who can call themselves a coach, right? That's where the state probably could step up a little bit of like, let's put some policy out there saying, if you're not an actually board certified coach, you can't call yourself a coach.
Right.
So I think that that's an opportunity for sure. But the state of California is using this model, and they're using it in the behavioral health space to fill gaps for children, and they're allowing it to be billable to California state Medicaid. So
Hmm.
yeah.
My mind working. So one of the ideas that I would have for you though is to get into the code, the definition of what a coach really is, to your point, because that is defining what it is the first way to funding. We had
Right.
to define the behavioral, I mean, we literally passed this law to define what a behavioral health, mental health professional was,
Mhm.
because as code gets added in, they'll add the name of coach somewhere, and then you'd only get paid in that one section of the world and not all these other sections where you're qualified. So trying to figure out like how could you get it into the code so that you exist is step one, and then funding follows. And so, but you're right, that's going to be your downfall, because anybody can take a Tony Robbins course and be a coach.
Yeah. There
Or
are,
name a name. I'm not
yeah.
picking on Tony, but there's
No.
100,000 of them out there.
Yeah.
And then now you're a
Yeah.
coach. Now they're a life coach. So then all of a
Mhm.
sudden, they think they can do what you're doing. And you're really talking about the medical coaching of this and getting the medical labs done and all of those things. And so how do we make you a niche so that it
Yeah.
can be professionalized in a way to actually be funded? And that's
Mhm.
really exciting idea. And if
Yeah.
California's done it, they're not the best example that we use in the state of Iowa to say, hey, do
Right.
it like California.
Yeah.
But I mean,
But
but that means that people like us can look at the code and go, okay, here's a piece where it's worked, and we can shift it and try to
yeah.
see, because I love this idea. I'm so
Yeah.
excited to meet you. This is really cool.
So, and CMS there are tier three codes for health and wellness coaching, but they're tier three. So, the National Board of Health and Wellness Coaches is trying to push it through to tier one. I believe last update we got, they had some conversations with some Dr. Oz's team. So, fingers crossed that eventually maybe that will become a thing. But I think in addition to that too is like I've had to be really innovative in how I find funding, right? And so looking at some of the grant opportunities and the contracts that are out there of like working with the at-risk youth, how do I spin that to show how coaches can help with building some resilience and some skills in those kiddos that makes it a viable application? And we've been successful so far. So it's
That's
fun
pretty
to
cool.
see.
Good for you.
Really cool.
Yeah.
All right. Well, everybody, that was just a whole lot to take in, and my brain is spinning just in the funding alone. I love that kind of stuff, and thinking of new policies, new ways to fill gaps. Very excited. But before we go, let's talk about the recovering politician self-care policy of the week. I'm telling you what mine is right now. Hot tea. I love hot tea. And the way I learned about how I love hot tea, I don't love all hot tea. Not all hot tea is the same. If you like craft beer, I like craft beer. Jason likes craft beer. Not all craft beer is the same. And the way you know is you go out and try it and find the kind you like. That's the way it is about hot tea. So many people are like, oh, I don't like tea. It means you've tried one kind. There's hundreds of kinds of tea. And so there's, caffeinated, non-caffeinated. There's herbal, there's all kinds. I love black tea. I love caffeine. And so I have figured that out, though I got this cute little advent calendar and like tried 24 days of tea and I've tried a lot of teas I didn't enjoy, but I found a bunch I do like. Those are been half price now post Christmas for everybody. If you didn't get one, you can go look because you can buy advent calendars off season. They don't cost near as much as during the holidays. And you try a whole bunch of flavors and then you're like, well, some of these are great. So I literally wrote on my box, you'll like this, Jason. I went and tried it and I put a big X. No, a big no. But then I'd be like, circle, this one's good. And so I love hot tea. It's just one of the things that can get relaxed, kicks me off in the morning. I have some to calm me down at night. I just love it. So Jason, you have a hot beverage. I know you're an iced mocha guy, but are you have a hot beverage you like at all in the winter? I mean, any kind of.
Well, year around, I love a peppermint mocha, and you know that I'm very, what's the word?
Picky.
Particular about the peppermint flavor. And
Oh,
so peppermint is not the same everywhere you go. And so there's certain coffee shops, and sometimes the smaller coffee shops, they use the same vendor for the peppermint syrup. And I don't like that kind of syrup.
uh-oh.
And so, I'm horrible and I do go to Starbucks. But they have the best peppermint syrup. And so I am all about the peppermint. Am I
There's a little
shallow and
persnickety
superficial
there,
by
Jessica.
saying
What
that?
can we do? So Jessica, are you a hot or cold beverage kind of girl
Mm.
in the winter? What do you like?
Oh gosh. Well, year round, I'm a black coffee, hot black coffee girl.
Oh, there we go.
Yep, yep. So, I love a good chai
Those are
tea.
so
Um,
good.
but right
Yes.
now I'm enjoying, oh, you can't see because it's blurred.
Oh,
I'm
cute.
enjoying some green tea in my mental health
In your
matters cup.
Love
awesome.
it. Love
Yeah.
it.
So I am trying some new teas, Renee. So
That's the only way you know. And you try them
yeah.
sometime and go, no, thank you. Not my favorite. Well, today we talked about our new friend Jessica, who's talking all about rural middle Midwest mental health, specifically coaching in the health coaching space and how we can tie that to mental health. What an amazing conversation. Just a great way to fill a gap that we have in our state that's only going to get wider. And so thinking about my brain's already spinning about policies and funding opportunities and all the awesome things to get her across the state so that we can fill gaps, and knowing that it's been done in other states means it's possible here too. We just may need to change. I know Jason thinks we can't, but we might be able to change, and it'd be awesome to bring it in. Before we go, everybody, please don't forget to follow us on LinkedIn, Facebook, or YouTube. If you leave us a positive review, we send you a prize. Thanks, everybody.